Good afternoon. My name is Dr. Olson, and I will be your professor for drugs, brain, and behavior, spring 2022. It looks like it's going to be another fun and unpredictable year. So hang on. I'm going to be as flexible as possible for you. And I believe I've set this course up to be maximally flexible. But my name is Dr. Olson. I've been studying drugs, brain, and behavior for well over 15 years. I did my PhD on cocaine, which is why I finished it under 5 years. I then slowed down a little bit as I went off to grad school and studied cannabinoids. But overall, I've studied many different drugs of abuse. Pretty close to all the different classes: benzodiazepines, neuroleptics, antipsychotics, so on and so forth. I am an animal researcher. I do this by studying, neurotransmitter changes in the brain, in addition to behavior in the operant box, where the rats press a lever. But, that's what my lab here does as well. So, in this class, we are going to really study three divisions. First, we will study basic pharmacology, particularly pharmacokinetics and pharmacodynamics. This is what students tend to struggle with the most, in part because it's new and a little complicated. But you can see that I've included that chapter in the modules of our Canvas shell. I never test from the textbook. I only test from my notes, and I often tend to go off book. I see the book as a supplement to help you understand what isn't exactly clear in the lecture material. And if you can find an alternative way to get that information supplement, whether it's from what I posted online or other sources on the internet, I am perfectly fine with you going that route and saving money. And, you end up, you might bring all those textbooks for your first move, for your fancy library, but I doubt they survived the second move from personal experience. So let me share the syllabus here with you, real quickly, so we can just skim through this. Again, the class is going to be primarily in basic pharmacology, then drugs of abuse, then clinically applied or psychiatric drugs. I would like you to develop an understanding of how these drugs, produce their effects by acting on the brain, will be the primary focus of the class. In here, I would like you to also participate in some discussions on somewhat controversial content that I think, is really, important for a college student. I sincerely believe that in a good course, you are going to learn more from your peers than you would the professor. Certainly, there are more distinct perspectives and educated ideas out there in your peers. So, hopefully that will be a chance for that, in addition to developing some communication skills. There is this grand deal that I'd like to bring your attention to. So I'm about to rattle off that you have a lot of discussions and quizzes that you have to complete. However, some of these are or can be dropped. You must complete all your quizzes and 5 of the 7 total discussions, but if you actively participate in discussions and posting on the Canvas shell, and then most importantly, if the class completes their FCQs at the end, so I can be evaluated, then I will drop your 3 lowest quizzes and your lowest quiz grade. So we need to get those FCQs done at the end of the term. Here's just general information on differential abilities, which I definitely respect and accommodate. For your grade, about 45 out of 90. So around half of your grade will come from the quizzes, another 15 out of 90 points for the final exam, 22 points from the discussion posts, and 8 from the short essay that you have to complete. So the quizzes will occur on Sunday, or it must be completed by Sunday at midnight in each week. We follow this very consistent schedule where you have really a week to get everything done for that week and get it in by Sunday at midnight. In here somewhere I say that deadlines aren't flexible. That's not really true. Life happens, especially for quizzes. I can give extensions on easily. That's a little harder to do with the discussions where you have to interact with your peers. But if you are having serious issues with that, I have alternatives for the discussions as well. But then the final exam is a little unique here. So I, am experienced enough with online education to know that if I just, give you guys a multiple choice quiz, it's pretty easy to find all the answers out there. And personally, I'm okay with that. That is the real world. You now have the internet in the palm of your hand or strapped onto your wrist. You can easily look up information quickly. So for the final exam, rather than doing any multiple choice or anything like this, it's all essay. And I'm giving you the questions in advance. They're already in the modules. So ideally, this is what will happen. Over the course of the semester, you will prepare answers to these short answer questions that comprehensively cover the main points that I wanted to get across. If you have good answers that expand on my material in some way, rather like application, how you could see this as being important in your career, specifically if you're going into the health professions, your own experience or other academic resources from other classes. It's perfectly fine to contradict lecture material. I want to hear you think. So, you can bring the material in whatever direction you want, but I would like you to expand a little bit on, what I taught you rather than just regurgitating it back. Perfect regurgitation would be a B+ or an A-. But if you really want that A, you're going to need to exceed, what was covered in class a little bit on those. And that will be due the last week of class. So on a weekly basis, I recommend that you check these calendars. Usually it will say something like you see for week 1, review my voiced over PowerPoint lectures or videos. And take quiz 1. And the first week, I just want you to do a Flipgrid introductory post, so you can get used to the technology and, develop some sense of belonging with your peers. For the discussion posts, you will read or watch assigned material, most of which is debatable, controversial. There is no really right answer with this. I am not trying to teach you dogma. I am trying to get you to be critical of information and, really tell us what you think. These are guidelines here, not things that you have to do to get a good grade on these. Just some ideas to get you started. You can say whatever you want. You can completely rip the author of the paper or the speaker. You can contradict them. You can expand on them. You can say that their methods are fishy, or you can say you really like their methods. And hopefully we will not all agree, but agreement is not what we're going for here. We're going for discussion, which are often boring if everybody agrees. But after you do your original post, you must respond to any 5 members within a 2-week period. If you do not do this part, I will reduce your discussion grade by up to 25%. The point of this is to simulate class discussion and also help you, feel like you're part of a learning community. So here are the topics that we will be discussing. And by we, I primarily mean you guys, but myself and the TA can jump in to add or enrich conversation if we need to. But first, I'd like you to review a proposal for drug scheduling that is an alternative to what is done in the UK, which is very similar to the US drug scheduling system. Then we will discuss sugar and cocaine, really comparing the two. I mean, is sugar more addictive than cocaine? What are your thoughts on that? What does that say about cocaine and what does that say about sugar? Will psychiatric medicine be genetically tailored to the individual in the future? I mean, there's a good one, especially if you're thinking of going into medicine or psychiatry. Are women or men more susceptible to addiction? Here, the basic literature, what we see in animals and rats, doesn't necessarily mesh what we see in people historically. So does that suggest, like, are gender roles in society changing, or are there just different things that apply to women that might prevent them from abusing drugs? Or maybe we just don't call women abusing drugs addiction. Maybe laudanum or other things have been used historically, or wine. The wine in the housewife with the benzodiazepines, or the whatever. Maybe that isn't addiction, but maybe it should be. I don't know. Lots to say about that one. Does cannabis abuse increase the risk for psychiatric disease, or does it prevent the risk of psychiatric disease? Does it treat the symptoms of psychiatric disease? Can it do both? Can it make you develop psychiatric disease and then treat it? I don't know. Discuss. Should psychedelics like magic mushrooms or psilocybin be considered as pharmacotherapies to treat things like post-traumatic stress disorder and trauma? And, the opioid epidemic, what a mess, what went wrong? And most importantly, if you were a doctor, what would you do to treat chronic pain? It's a horrible thing to see someone in chronic pain, and are you really going to deny them some of the best pain medications that we have? It's a very difficult thing to wrestle of what is doing the least harm and the most harm there. A fun one to think about in my mind. So here you can see our schedule continues. Oh, I did want to post or give you a note on how to post the discussions. You'll learn this in your intro video post here this week. What you need to do is make a Flipgrid video. What this means is you follow these steps. When you go to the discussion, do not go directly into Flipgrid. If you do that, we will not be able to see your post. So please make your post by clicking Flipgrid in the actual discussion post. Then create your video, which can be a maximum of 180 seconds. And then do your replies through there as well. Again, if you don't do it through the Canvas system, we won't be able to see your post, which will be stressful when it comes to grading. Of course, we will work through it. Let me know if that does happen and we will find it. But it would be better for everybody if we can just see your post by posting it through Canvas in the first place. You also need to prepare a short essay. So here I want you to select one of the discussion topics that you really want to expand on and follow up on it with 2 independent resources. You must include the citations in either APA or Vancouver format. If you're not a experienced psych student, there's an example of my preferred format down here, Vancouver. Your essay should be between 500 and 600 words in length, excluding the references, and no title page is necessary. In general, I'm not going to be looking for APA formatting so much. I just want clear references. So you can see a nice reference list at the bottom and insight text citations like you see up here. How do you do well in this class? So first of all, stick to the schedule. This is designed this way on purpose. So you have a very consistent schedule that you can, or routine that you can fall into, but also one that provides flexibility. You can do this on Thursday night or a Wednesday morning or a Saturday evening if you must. Within each scheduled module, view my recorded presentations. Taking notes is necessary. And then I would look at the main learning objectives and think about how you would teach the material if you were explaining it to somebody else, and then do so, explaining it out loud. Whether it's to somebody else, your dog, or the wall, doesn't really matter. What matters is you say the material in your own words out loud. If you do that a couple of times, you will remember so much faster than if you're reading the book only or just scrolling through my notes. Yeah, actively learn. And this is really for any class. That's the most effective way to study. Keep up with the discussions. Hopefully these are fun for you, and work on the essay and the final exam prep over the course of the year. Also has lots of questions. We have a TA in this class this term. Use us, take advantage of us. And I have some final statements here on inclusivity, my inclusivity, pledges. What I would think is most important for this class is that you review our community discussion norms. There are things in here that could be deemed controversial, particularly, the sex or gender and addiction comes to mind. There are some interesting new concepts like intersectionality that could be considered or discussed. And especially drugs of abuse. Some people have had their lives ruined by possibly even cannabis, whereas others find it to be this wonder drug that they think is, better than sliced bread. And then everywhere in between those two. So, be respectful and know that people are going to have different opinions than you. And that's okay. The goal is not to attack the person you disagree with. Be willing to consider their perspective and then critique the idea rather than the person if you disagree. You can completely challenge these ideas. You can challenge the ideas that I give you. In fact, I encourage you to do so. And, answer in debate. Don't just suppress your thoughts. We want to hear from you. All thoughts are welcome in this classroom. And, acknowledge the things that you agree with, but don't make assumptions about the person saying them. Think about the ideas, not the people. And be willing to accept a lack of closure. Not everybody is going to believe what you believe about magic mushrooms or cannabis, and that's okay, completely okay. So that is the class. I, look forward to hearing from you. Let me know if you have any questions. I particularly would like it if you post in the virtual office. Thank you.